Well, that's what that's what. Okay, let's go ahead and call the meeting to order. Do we have any minutes and reports received and filed?
No.
Nope. Commissioner Committee Liaison Reports, upcoming meetings and events.
We got ED meeting today. Fair all week and breakfast Friday morning. You going to buy a goat?
I'm gonna buy a country ham.
They got goats.
I know they have, that was,
Al.
yeah. I don't think I want a goat.
We can buy one and put it in your office.
I don't think I want a goat. I think I want a.
Take it out to the county park, turn it loose. Free range goat.
I don't think so.
So with some of them free range kids. You,
We could have a petting zoo here at the courthouse. No?
it is a zoo here. You better keep going.
Yeah. I don't think I have anything.
We got the Samaritan Center Gala Thursday night. Downtown's Piccadilly and White Friday night. And, I got the fair and country ham breakfast, so. Okay. Unfinished business. Bids and contracts, discussion of bid award for 2015-20.
Were you gonna do the presentation, number 5?
Sorry, Christie. Presentation from staff, on Workshop Wellness Committee.
Good morning,
Good
gentlemen.
morning. I'm sorry, I
Wonderful
apologize.
to see you guys.
See
Brought a
you.
little bit of information for you to kind of follow along as I ramble on.
Okay.
Here you go, sir.
Thank you.
You know me, I'm Ashley Warner, Health and
Mhm.
Lifestyles Coordinator in a new position with the Health Department. And as you see at the table here is our Worksite Wellness Committee. We have Christy Campbell, who's our director at the Public Health Department. Nick Lumpy is with us from the University of Missouri. He's our intern for the summer. And Jennifer Pranger. I know I was almost going to call you Danielle. Betsy Rackers and Melissa Johnson. A few of us aren't here today, but we wanted to have good representation to have an open discussion about how we want to move forward on this.
Okay.
There is some supportive data there. I do have a couple of extra handouts for anybody in the room that is interested. There's supportive data, and then as we move along, there'll be some other handouts.
This is all the same.
Yep. There's one of those, and there's a couple of these. As we move along, there'll be different things. Here you go. So knowing about Worksite Wellness, I believe Mr. Bushman sits on the board for Capital Region, charged public health with coming up with some sort of wellness program for the county employees. And we know how important it is simply because it increases our productivity, reduces our absenteeism, amongst many, many other health benefits. Some of the supporting data that you see in front of you is from a survey, a workplace wellness survey. 4 primary causes of chronic disease, 4 behaviors that are primary causes, are inactivity. They say the sitting is the new smoking, poor nutrition, tobacco use, and frequent alcohol consumption. Chronic disease is estimated at 75% of national health expenditures, which also causes more absences from work and less productive while you're at work. There is a 2010 survey that states 67% of employers said employees' poor health habits were one of the top 3 challenges to maintaining affordable health coverage. We are so lucky that you guys cover our health insurance, so we want to maintain that and do our part, right? Cumulative losses associated with chronic disease was about $1 trillion in 2003. $277 billion of that was spent directly on health care, meaning 3/4 of losses were because of absenteeism or reduced productivity. An incentive of about approximately $50 per year is effective to have employees complete a health risk assessment. A health risk assessment, or an HRA, is a tool to collect baseline data for things like body mass index, glucose screens, cholesterol screens, activities. So you want baseline data to measure where we start so we can evaluate at any point 3, 6, 9 months, a year down the road what kind of benefits we've seen, okay? HRAs are the most common screening technique. They're used in over 80% of wellness programs with usually 50 employees or more. Those tests that I just mentioned, blood pressure, blood glucose, cholesterol, BMI, those are the most popular clinical screening tests done when you're starting a wellness program. There is a return on investment, and that is 3 to 1 for direct costs and absenteeism. And medical costs drop about $3.27 for every $1 spent on wellness programs. It's a pretty good drop there. For wellness programs to reach their goals, we need you. We need management to play an active role. We know that if management supports from top down, you guys can make the elected officials tell us to do whatever we want to do, right? 60% of wellness programs reported a reduction in their healthcare costs, and about 80% reported a reduction in absenteeism. And it says about 70% of those programs offered financial incentives for behavior changes. So we are at the ground level here, just starting, so doing some research and moving in. So what we decided to do as a committee is to talk to the employees and find out what they want. And you all should have received and filled out, and just say that you did receive and fill out a monkey survey, or Survey Monkey, asking about 7 or 8 questions as to what you desired from a worksite wellness program. And the results that we received from that survey, we had about 86 respondents out of about 300 plus employees here at the county. And of those 86 respondents, 2 things came to the top of the list. Those employees wanted a discounted membership to a local gym, or a membership to a local gym, paid in full, a discount, a stipend, something so they could go to a gym and work out. The second thing that they wanted was time during the workday to do that. If it was a half an hour every day, 5 days a week, that's 2.5 hours. If it's 2 hours, whatever that may be. That's what the results of that survey told us. The discounted membership would be very easily integrated. I understand that when we onboard new employees here at the county, that would just be one of the benefits that we could share with them, and they could opt in or opt out of that benefit. There are some things that can be offered currently through existing staff, and you have examples of them. You have an example of a newsletter. It's called In Good Health, that Nick did such a wonderful job preparing for us, with our newly embossed Worksite Wellness logo here at the top. That was chosen by the committee, and you can kind of look at that. So we can do newsletters quarterly and monthly, or whatever the desire is. Another idea the committee would like to see done or recommend is that these are called point of decision-making prompts. And what these are, and I'll get up and I'll pass these around. Okay, these are these 2 handouts that you have. Want to take a look there? These are just examples that we would take up. Nick and I actually went around to all the different county offices, and we did a tool called, it's a SWOT tool, and you go around and you survey and you analyze the environment. So where are the stairs? Are there stairs? Is there an elevator nearby? Is there an ice machine or a water machine available? Do you have any exercise equipment on site? Do you have anything posted in the employee kind of lunchroom or break room that encourages use of physical activity, encourages eating of fruits and vegetables, those kinds of things? And what we found is that there is a tremendous amount of opportunity at all of the offices that the county is in. I'm going to pick on is it the assessors? No.
No, he's here, don't pick on
Assessors?
him. We wait till they're not here.
Right next to the library.
Collector.
That's it, yeah.
Do the collector.
So you walk into the assessor's building, for example, and it's nothing personal, but there are 8 signs pointing to the elevator, how to use the elevator. There are 0 signs indicating that there's stairs in the building. So we know that we can put, basically what these do is a point of decision-making prompt. So we can put this near the stairs, we can put this near a source of water and say, you can burn X amount of calories taking the stairs versus taking the elevator. Or you need water because of these X benefits, okay? So you're in that point of decision making, and it's going to prompt you to make a healthier decision, right? So these are all things that can be done now. They don't cost so much money. And the last thing I just wanted to mention was a learn over lunch presentation that can happen at any and all of the sites in the county, kind of on like a mobile basis. So it would be, you'd pick a topic and, myself and Nick or somebody from the committee, or you can go from site to site to site and provide, 20 minutes over the lunch hour of health education, right? So those are some things that existing staff can do. And then there's definitely some things that we can spend money on. And with that being said, the last handout you have is that sort of menu. And before I kind of dive into that, do you have any questions about anything I've mentioned thus far? Okay. So I played around with the idea of a menu. As you can tell, there is, as we kind of go through this, please keep in mind these are all recommendations and research done by the committee. This is kind of a menu. When you go to a restaurant, you can kind of pick and choose what you're going to eat, right? So you can kind of pick and choose any of these options, every option, whatever it is that our heart desires as a county, okay? So under hors d'oeuvres, these are things that I've already mentioned that can be done. They can start now, okay? We can do the mobile learn over lunches. We can do the point of decision-making prompts. We can do the newsletters. We can say to our employees through a memorandum by you all, feel free to work out 2 days a week, or 2 hours during your work, 2 hours over a 5-day work week period of time, okay? I tried to put some projected cost to it over a year's time, and those are gonna be our probably less expensive type of things that we can probably incorporate or implement. You're looking at breakfast. Underneath that is a discounted membership through either a contract or with a local gym, or a stipend to use towards a membership. We had contacted any and every local gym here in our area, and you can range from, $10 at Planet Fitness to $40 I pay for going to the Y. So we're just more or less bringing that information to you and allowing you guys to make those decisions. But we thought either a local, a full membership or a stipend of some sort. And it can look a matter of different ways, right? So we can provide a stipend in somebody's monthly paycheck, and that goes towards a gym membership. Now how you would police that or make sure they're using it for that specific membership, we haven't come up with an answer for. Or you can just have a contract with a local gym that, when you onboard a new employee, they have the opportunity to go over and then fill out a contract, and then the gym would then, send a bill to the county type of thing. So you have right. Yeah, it can be for any amount. So you can kind of go a couple of different ways with that. There would be some, if you want to police that on any end, if you provide a stipend, there probably would be need for some sort of staff to manage that data and be a contact point person for that. The other thing under breakfast is a health risk assessment, and we just mentioned earlier, it's just baseline data. It's a tool to capture baseline data. And that's data that you're going to use to provide to your health insurance company and say we've reduced X amount of weight, or we've reduced X amount of blood pressure in these X amount of employees, okay? And we've talked to Capital Region. They are doing phenomenal things over there. I'm really impressed. I did wellness at a hospital right out of college, and I'm just really impressed with what they're doing, let alone with the Fitbit program. They do provide biometric screening and testing in the community, and they have a whole palette of different testing that they can do. An HRA through Capital Region per employee is about $40. So the committee more or less recommends that as a baseline tool. They have pages of different things that they can do and different charges that they do and different screens that they do. But we thought one thing that if we were to recommend would be the HRA. You can look under dinner, which, as you can tell, these things kind of move a little bit more money-wise. They get a little bit more expensive as we move on. The employee wellness program, for example, like what Capital Region is doing with their Fitbit program, they get reimbursed. You can buy Fitbits. We contacted that company, and you can actually you pay $85, you get a reduced rate, and you buy in bulk. And so you pay $85 up front, as like the county would. And then as the employees more or less partake in the program and they get their 1 million steps, or however the program would be run, then they would get reimbursed that money, okay? I said that wrong. The employee, well, the county's gonna have to purchase the Fitbits. And then the employee would, or like, for example, I have my own Fitbit. So I've already paid out of pocket for this. But if we took part in that program and I got my 1 million steps, I would then be reimbursed up to that $85 rate, okay?
Okay.
It could be any fitness tracker. There are many out there. Many, many, many. You could do a semi-annual or an annual motivational contest, like the countywide Biggest Loser. Be an awesome thing. We see that once a year, maybe twice a year. Of course, you're looking at staff time to manage that data and to incorporate the different parts of that program. And then lastly, the dessert. Of course, I would love to see some policy change. I think the committee would love to see some policy change regarding tobacco use in the county, or maybe designated smoking areas, things of that nature. That would not cost a whole lot, but there would be time and effort going into that. And buy-in from staff and county. So, that is your menu of services. Wellness Committee, would you like to add any? I do want to mention, part of Melissa's job is to provide GIS mapping. And so if we did some sort of a walking program along with the Fitbit, and there's so many ideas and so many different things that we could do. Another thing that, you want to mention that?
Yeah, so
Yeah,
did
we've
you
already
see?
got the maps, most of the maps created that kind of outline 1 or 2 mile walking from the different offices. Excuse me. And they are, I've kind of based them not on, you know, walking along busy highways or areas that, you know, don't seem like they would be very.
Well, for downtown workers,
Tracks, yeah.
there's a
Fitness
fitness
mile.
mile already
Yeah.
laid out,
That's
so you
one of
can, you
the-
can just use that signage and that'll
And
take
that's
you.
one of the trails that I've actually mapped
Yeah.
out, because they didn't have a thing. And I actually made another one that was like 2 miles, it's around the Capitol, because people get bored doing the same one over and over again, so I thought some variety, you know, might be.
Now, what Cape Girardeau County's done, they have a wellness thing, and they have a contract with one of the hospitals that has a healthplex, and they get a reduced membership. But then if you, I want to say it's like 9 hours a month or something like that. If you work out 9 hours a month, you get another reduced rate. So the more you go and work out, the less expensive it gets, and that's given by the hospital. That's
And then,
passed
I don't know
on.
if you guys saw this in yesterday's paper. Don actually pointed out this morning, they had a whole section on keeping your employees fit. And I guess Wall Street Insurance, they have like a little gym in their, you know, building for people to use whenever. So, you know, that'd be awesome to do in our buildings. I think the other thing we need to keep in mind is it's not a one-size-fits-all approach. Everybody's different, you know. I don't take the county insurance because my husband's insurance. I don't go to a gym. I work out at home. I don't use a Fitbit, but you know, I've lost 15 pounds this year. So everybody does it differently, and it works differently for everybody. So what is an incentive for one person, another person's not going to care about. So we have to realize that, you know, it's all very individual.
I think this is just really the beginning of a conversation, you know, to get feedback from you all, give you time to process and.
Well, the whole idea is if we have healthier employees, it's going to save us on our medical.
And we'll
so,
be more productive.
yeah.
You know, healthier people are more productive.
Yeah.
Yeah, I don't think we can afford not to do something.
Right.
So even whether we start little or,
So do you want us to go ahead and start with those free things like the point of decision prompts and the newsletters?
I think the newsletter would be good.
Okay.
I don't know how, are you gonna try to do it by email or? So I assume
We'll drop a few off
everybody's
probably.
got an email set up with our payroll now, but, So the health risk assessment, is that something that we should do yearly, or is that kind of a one-time thing, or every so often?
I think they
or-
recommend it at least annually.
Annually, and then for any time any new employee, onboards, they would need
And
to
then it's
complete it at
part
whatever
of-
time.
Part of a physical that people should have every
Thank you.
year.
And that's what we did before when we had the other insurance, we did that every year, and the
Didn't you
employees
get,
got
like-
a gift card for like $75 to a different, retail place, and, I mean, I thought that was really nice, but they aren't
That was before
offering
my
that
time.
anymore, so.
I think that was when when the county had a different insurance carrier, right?
It was.
That was before we went partially self-insured.
Yeah. Well, I love our steps right as you come through the door. I've never ridden the elevator since I've been in office.
I never take
Yeah,
the
but
elevator.
yet there's more people standing there waiting for the elevator.
Yeah.
And it's like, God, those steps, they put them,
I was gonna say, the elevators are so slow that you're
Yeah.
losing time.
Yeah, we took ours out of the health department. We don't even have one anymore.
yeah.
Well, I just think that it's ironic that you say that there's hardly anything that points to the stairs.
Yes,
it
it
is.
was, it's
so it's-
funny in a sense, almost, that,
So it's, it's not as bad here, but I'll say in a hospital, it's terrible. You guys need to have signs that point to the stairs, because you can't find a set of stairs in a hospital.
No.
I mean, it is almost impossible, and I hate waiting for an elevator.
Then when you get off, you don't really not necessarily sure where you are.
That's true.
Courthouse.
There's no stairs in the court. I mean, you can't there's no stairs over by the elevator.
Yeah, so,
just so you know too, just a side note, we were able to find out some information about the county employees and kind of what illnesses they're dealing with. Kind of the top, we're looking at asthma, ADHD, and diabetes. Those were the top 3. So, with that being said, that's what we're spending prescription monies on. So to see a decrease in maybe prescription use or cost of prescriptions, that would be a totally measurable piece of data. That could be our goal or whatever. There's so many ways to go through this. It's very exciting.
I'd like to see us do a monthly newsletter.
Okay.
I'd like to find out how many people would actually use a membership, or if they would rather do something different, like Christy said, she works out at home, or,
Well, that was the top response.
Well, we might do a
They want it.
contest too, the county's biggest loser. I don't know what kind of carrot you can put out there, but
We've done it twice at the health department.
I think that would be kind of neat.
And when people had to pay to participate, they pay, the first time we did it like per month. So at the end, the winners got money. And then the next time, I think they just did it, this year they did a general fee up front. So you pay to participate, and at the end, the top 3 got money. So that's what we did.
I'd really like to see us do this health assessment too. I mean, if we need to know where we're starting to know if we're gonna do any good, and it's, so.
I believe the Capital Region's in year 4 or 5 of their program, and they've just seen it, grow, and then I think it was over $400,000 they've seen in savings on there. It's phenomenal.
Yeah, their presentation was really good, that they came and did with our committee.
Yeah.
I was very impressed by what they're doing.
And if that's a step that you guys would like to hear, from an established program, I'm sure we can work something out that they can come in and talk about that too. So,
I mean, we've done really good with our health insurance this past year, and so time will tell how well this partially self-funded thing is gonna work, but, I mean, costs aren't gonna go down, and so the healthier we are as a group, hopefully we can hold our costs to a minimum of an increase, but anyway,
We got to start somewhere. So yeah.
you guys got any input?
Just lead us in the running.
No, y'all just want to take me to a darn building. I don't know, there's all kinds of data that says how the worksite wellness works and stuff. I guess I'm just a hard ass about it. I think people make their own choices, need to have a little bit of responsibility themselves to do this stuff. I think a newsletter would be a great idea to tell them how they could feel better about themselves, be in better shape, lose weight. Their
There's like
morale
healthy
would be
recipe-
better.
There's healthy recipes in there, so.
Feel better for yourself. Yeah, I was kinda looking at the one, but, speaking of dessert, what kind of policy changes do y'all have in mind? You know, when you put tobacco-free, you really kind of are.
Or,
Columbia Boone County has a very extensive policy on what kind of food can be provided for meetings and lunches. I mean, it's very extensive. I don't know if you wanna go there, but.
So reimbursement for only healthy food?
No, like if you provide, yeah, if you provide food at a meeting, it has to meet certain criteria. It's pretty extreme.
Shooting up heroin.
for example, when Nick and I went around to all the different sites, you walk into the jail, and you've got employees and people smoking all over in the front, right by the front doors. When you walk through, you're walking through a cloud of smoke. And we had to come in and out a couple of times. I walked, Nick and I do a walking program for one of the, for JCAC downtown, and we do walk the fitness mile, and we walk by several days, because that's part of the fitness mile. And I can see people out there and just in the front of that building smoking. And so that site, maybe that there's a designated smoking area, and if it came down to it that you guys were really interested in seeing some results on tobacco use, maybe there's a penalization of, if you get, I know Capital Region does a test specifically to see if you have nicotine in your system, more or less. And, if that was free from nicotine, then there's an incentive, or there's a lot of different.
If you smoke, you
We
have to
have a
pay.
smoking
not just-
policy.
Yeah.
And you're supposed to be, first of all, in this building, really the only smokers are court employees, it appears to me, but there's a certain number of feet from entrances.
Right.
From the
There-
wall,
yeah.
so they may not be following the smoking policy over at the jail. So that could be an issue.
And we're
Maybe
not
we need
just
some
talking
signs
about
or some
smoking with
posting or
tobacco
something.
use. We're talking about,
Chewing.
chewing tobacco and.
Hey.
Well,
Let's
I
not
mean,
get
it
crazy.
is still, not a healthy habit. I mean,
Well, I know the
Right.
city, they have their smoking ordinance, and of course, we've got spectators next door. My God, I guess more than half the people that drink smoke, 'cause I've never seen, we sweep up cigarette butts. If I got paid a penny for every cigarette butt, I'd have hundreds of thousands of dollars. But they're not smoking inside, they're smoking out in the streets and in the back of our store, and
Well, I'd be interested in seeing who else we can partner with to do stuff with this to keep our healthcare costs down. That'd be a direct benefit.
yeah, I think, yeah.
We don't have a health provider per se that we used to be more interested in it too, because they wanted to see us have fewer claims and stuff, so.
Yeah, fortunately, we
I
don't
keep
have this
going
thing.
with it. I'm still thinking it's personal responsibility. People need to take responsibility for their own health, and I'm as guilty as anybody else. When I sit down and have some of these, I shoot up with bananas or not bananas, donuts.
Donuts.
Not bananas. You go walk into the store, you got donuts on one side, fruits and vegetables on the other. Well, I'm telling you which way I go.
We talked
You know.
about making the healthy choice, we talked about this, making the healthy choice the easy choice, like at our office, we don't have any machines, we don't have a soda machine, so of course the easy choice is to go get water out of the fridge. So, you're right, you have to make
Us
that.
unhealthy people will find soda.
Now in our building, you have to
So
walk,
unless
you have to walk down break
yeah.
time.
You have
Get
to
your exercise.
make
I will
effort.
bring a 2-liter bottle along.
Well, it's
No,
like the
I'm serious.
cost.
It is your own choice, though.
Yeah,
Yeah.
it is.
Sometimes it's just, people want to be healthy, but
There's an
they
education.
don't think about it all the time.
Or
So
they don't have
sometimes
the
just
willpower.
seeing that,
Some
I think that you're at work and your workplace supports that.
Yeah.
And
That's
it costs
pretty
more to
powerful.
be healthy.
Water's,
But it's preventative on your medical costs, sir.
I ain't preventing anything on mine right now.
we said, everybody's different. It's not a one size fits all approach.
And not everybody's going to be on board, not
Yeah, no, I mean,
everybody's going to want the
yeah.
BMI.
Yeah, you're not gonna be paying, I put probably on that menu, I put the top cost. So if all 300 employees said, yep, we're gonna do the Fitbit program, or yep, we're gonna get an HRA, which is highly unlikely. We had 86 respondents. Out of those 86 respondents, how many of those people are actually gonna take advantage of that
There might be
benefit?
some that
So,
did
Yeah.
survey that wanted to.
so it's
get-
not gonna probably be as But you had to see the big numbers so that you have an idea.
We can just start it out with a baby step, and then we might even go to Cap Region Healthplex and the YMCA and some of the others, see if they would offer a discount to the county that you could, I mean, you just post them and say, hey, here's a discount because you're a county employee that you would pay.
Right.
The Y always offers corporate discount.
Yeah.
They do.
When I worked at
They
Capital
do.
Yeah.
Region, I
Yeah.
mean, they had, Y gave, I don't know how much percentage it was, but it was a monthly break.
Yeah, and Cap Region's doing that now too, because I know we're
We
working.
still are on it.
Um,
You know, probably anybody as a corporate, if the
Yeah.
county did it,
Yeah.
we'd get a reduced rate.
Contract
just
with
to
Yeah.
do that.
entity.
So we might talk to a bunch of them, because some people, they do prefer, plan a workout or whatever, they,
That's where I go.
yeah, and just see, so if you can save some money doing it, and that doesn't really necessarily cost us anything, then it's,
As a committee, we'd like to know more or less kind of when we walk out of here today, what kind of spending power do we have? How much, I mean, we're looking at budget-wise of.
$20.
I know, the Healthplex and, we can do a contract.
Maybe
and we'll look at
25.
that,
No.
$25 per person, what is that look like for you?
Gotta watch it.
How much money can we spend? Yes.
I would say bring whatever you recommend and show what it's gonna cost and what
Well, I mean, that's
what you
kind of the
think
menu.
is gonna be the savings or what benefits we're gonna have from it, what our return on investment's gonna be.
All of that.
Cause buying everybody a Fitbit, I don't
Yeah.
know, counting steps, I don't tie it to my dog's collar and let him run around and get 1,000,000 steps in.
But there's a lot of them that do that over at Cap Region. That's really gotten big.
That program
They
is
tie it to
huge,
their
yeah.
dogs? Oh,
No, but like Dr. Light walks her dog.
I can give it to my kids, tell them go out on a trampoline, knock yourself out.
Most people are going to be
That's
maybe
72
more.
million steps last year, see? Look at this shape. While I'm drinking soda. Y'all should talk, because I'm gonna be talking soda. Is coffee on there
You told us
too?
it was water and coffee's good for you.
We thought we were going to miss Chris today because of his son, and maybe we should have just had.
Well, Jeff, I'll agree with you a little bit in that it's every person's kind of responsibility, and so as people make poor choices, their healthcare costs go up, and if people make good choices, their healthcare costs go down. So when we all get pooled together, somebody making poor choices increases all of our costs.
Yep.
And so, but until we know, until we really have that health risk assessment on every person, we don't know whether we're going up or down or we're just flat.
Chris, you need to do an incentive or something. You can't force people to do that because we're the government, so it's a Fourth Amendment search.
Mm-hmm. So,
They need to consent to it.
and that's,
Yeah, it would be optional, and that would be all part of, I think, of course, the rollout, we don't know what that looks like until we know what we're doing. First of all, we need to know what we're doing to roll out the information to existing employees, but the onboarding of new employees therefore would have the option. All of it's optional. If they wanted, if we have a contract with the Healthplex, because they do offer corporate sponsorships or corporate discounts, then they have the option of going over there and signing their contract, and then they would then bill the county to pay for that.
So one of the things that we could really look at is, since we are partially self-funded, is we have an insurance pool of funds that we spend on basically different things, and so we could use some of those funds to pay for some of this health portion. I mean, so it's not like it's coming out of GR or whatever. It could come out of our health insurance fund. I mean, I think we have to start somewhere, and so I don't know what you guys are comfortable with, but so.
All right, if you'd like to resume and have another discussion about this in, a few weeks, or.
I mean, are we all good with the monthly newsletter?
Mm-hmm. Mm-hmm.
So I don't know what
I
that.
can start today, yeah.
I don't know what that total is going to be, but I mean, it's a couple
Sure.
$100.
That's a
Always
point of
staff
decision
time
making
and
from-
email it out.
These are great. I'm looking at this thing, and it remind me, get up from my desk,
Mhm.
and
Stretch.
walk
Yeah.
around.
Speaking of that, I know that several employees at the health department are interested in standing workstations. That's probably the one thing I missed from DHS. I had a workstation where if I wanted to stand up.
We'll take her chair away.
Fit
Oh,
in
you meant
there.
the standing ones.
Yeah, the stand. So, standing workstations, because sitting's really bad for you. The one I had at the health department cost about $150. So, things like that do make a difference in people's work life.
I mean, so I'm good with the worksite wellness thing. I think that's pretty minimal. And I'd like to see us at least have some more things located near our stairs that would say.
Those point of decision
Yep,
points, yeah.
mhm. And I don't know if you want a sign or something, and I don't know if maybe Public Works could help out with that or something.
Oh, like pointing to the stairs?
Mm-hmm. Rather than just a piece of paper, I mean, I don't know how you're gonna do that, but,
We were discussing kind of maybe switching them out occasionally so people aren't always seeing the
Like a
same one.
laminated piece
so
of
then
paper.
If
Okay.
they switch it out, then they'll, maybe pay more attention to it.
okay.
Like the one about, you burn more, this many calories if you go up the stairs versus. the
Put it right
elevator.
on the elevator.
But they-
Right, right by the button. Yeah, when they go to push the button, they're
Turn
like,
around, go up the
"Oh."
stairs, that's what it's gonna say.
Yeah.
Stop,
Stairs
turn around,
behind you.
go up the
Yeah.
stairs.
Stairs
Yeah,
behind
it does amaze me, the number of people that ride the elevator. It's like, why? These steps, these are slick,
Oh, they're slick. Don't say that.
Huh? No, but I mean, it's just so much quicker to,
Right.
Sure.
If we don't engage the employees, they're not gonna do anything different, so, I mean, and our costs will just go up, so. But, I mean, we can bring it back and talk about more stuff, or I think we just need to keep plugging forward, otherwise it'll just get lost but maybe do these baby steps and then look at some other things too, Jeff, or whatever.
I'm good with that, yeah. Look at some of the other stuff and bring us some recommendations. We can meet every month or 2 months, we do administrative meetings, and with the department heads too, we can get together and talk about it some more.
Okay.
So, there's a lot of good ideas in here.
Do you want us to bring you more of that information from Cap Region about their health risk assessment and?
Would that be
with
helpful?
I think so.
What it's gonna cost, how it's gonna,
So do you want a
They
presentation
They would
from
come and do a
them?
presentation, Tiffany would probably, she already offered.
Because if
so.
it's gonna cost us $40, but we need to get people to do it, we're gonna have to incentivize.
Incentive, yeah.
So now
And
our
they've
cost
done
might
that,
be,
yeah.
say we did $50 per person, so now we're at $90 a person. So now we're looking at a little more money,
Yeah.
so.
Cap Region should do it for free. It's just like when you take your car into the automotive shop, you bring it in there, you know they're gonna find something wrong, so they're making money.
No, do you want
See?
a
But they charge you $85 for diagnostic.
If you're gonna check under my hood, you're gonna pay $85 for me to come in. And you're gonna find something wrong with it, that's why I don't go.
Well, we would be certainly happy to contact them and set up a presentation for you.
Yes, I'd be interested in
Yeah.
looking at some partnerships so we could work with, like,
Yeah.
them and the Y, and some of them that we mentioned.
Okay. we'll
Yeah, maybe have them
contact
come in before we start all this budget stuff. and-
them. Yeah, we can see if they can come pretty quick.
Yep.
Okay, thank you.
Thank you. Make good choices today.
You're gonna take the stairs.
Okay, now we're going to bids and contracts. Discussion of bid award for 2015-21 access control.
We are revisiting this from last week. I don't have any updates because I
I
didn't
just
get any questions.
wanted
so.
to talk a little about it afterwards, and I was fine with all systems. I think, Chris, you indicated you were good with them. Jen said we need to decide what buildings. If we're gonna do all of them, including Carnegie, which we had looked at possibly getting rid of or getting out of at some point. I don't think that's gonna happen in the near future, so I think we just need to do all of them.
Did you have any recommendations, Scott, or either
Both, I
way?
mean, like I said, both BH Pace and All Systems were both, I mean, they were comparable, so it was really up to you. I mean, my only concern was DH.
Their service kind of $400 some for a service call.
Well, and they're basically, everything goes on not ours, on the county servers, which, you know, then they're kind of reliant on ours, or the county server, in case something were to ever happen. Dale's gonna have to be around all the time, as opposed to All Systems has their own system. So if Dale's on vacation, you know, they can still work on their system. And that was, you know, that and the fact that they do a lot of business or in and around Jeff City. I don't know anybody from either company, so, and I've not seen either one of their work, but they do a lot of stuff in Jeff City, so if they're already close to Jeff City, I think maintenance is coming down, and they're willing to negotiate.
That's the
maintenance
all
contract.
system, the one that has the schools and all that stuff.
Yes.
Yeah.
Yeah, I just, as I look at it, I mean, they are a little bit more, but you're getting more. So, you know, as you say, they're putting all their stuff on their own servers. If we are gonna go to just an hourly rate for service, I think they're the better one, just because they're out of Columbia. And so, anyway, it just seems like a more comfortable.
Did you guys decide, I mean, part of the discussion we had, I think when we were talking to the companies, who's actually going to manage the system? I mean, is it gonna be Donnie and the marshals, or, I mean, I don't understand how the administration of it, who's taking care of all the cards, who's assigning them, you know, when somebody leaves, shuts it down and that kind of stuff. Was that discussed?
So I think, I think maybe one person will be over the whole thing, but then each individual building will have their own administrator as well.
You can do either way, yeah. I mean, with both systems, you can do either way, and that's, you know, I don't know, you know, Donnie wants out of it, someone's gonna have to take control over it. And if you don't have somebody taking control over it, you know.
So do we need one person over the whole thing, or?
I mean, I would definitely recommend that, and I don't know Donnie's longevity within the county. I mean, do you go with somebody, I mean, do you go stick with the marshal, but have multiple marshals be able, I mean, that would be, in me looking at it, I would want multiple marshals to know how to work the system. Or someone's gonna be here for a while. Because, you know, Donnie's on vacation and you need to leave an employee for whatever reason, that needs to be done immediately. And that's kind of why you're giving the administration to each location, but you still have to.
Yeah, the problem with that becomes is people like maintenance have access to every building. So you can't just have somebody controlling one building and taking care of that person. You have to have an overall, so you can assign to anywhere. But, you know, somebody in one building, I mean, if they're employees like health, normally they're just in health, but I certainly have a few over here that can go in and out of the courthouse and everything else. So you can't have just them controlling courthouse then, you know, so it gets to be a little bit awkward without having a central control, to handle those situations.
But wouldn't each one handle their own, like Christie would handle health, going, well,
Yeah, but
okay,
if
great,
somebody
but
left,
hold
if
on.
maintenance left, you'd have to call every building and say, somebody's left, and they have to take them out of, you'd have 5 or 6 people having to remove their stuff simultaneously to preclude, you know.
Christie's got control of her own building. She goes, this card can come in, has access, this card doesn't, puts in a number, takes out a number.
But what he's saying is maintenance has access to several buildings, so each building would have to
Really,
lock
the
them out.
benefit of having everybody, like Christie has her own building, if you got, has a disgruntled employee at 11 o'clock in the afternoon, and, you know, she leaves, Christie can get on there and delete that person
Right.
who's coming back in. That's really, and then also Christie wants to run her own report of her own facility for the last week to find out who's been coming in and going out. That's really the only thing she'll really want to do. Beyond that, if she's gonna hire a new employee, I would probably have her directed towards the marshal's office to say, hey, we're hiring Jeff Helsher, he's gonna come by and get a card, you need a picture on it, stuff like that, so then they can create a data within that.
And that's what we did when
Yeah.
we came in, when I went over, Ralph, I think it was Ralph Ray.
I'm
and,
saying it would still be the same as that, but Christie controls who comes in.
We
and
went
out
down
of
to
her
Donnie, yeah.
Spot.
Yeah.
or her building. Where we can have, if we just want 2 maintenance people having permission to be in there, so we have control over that, because you do have meds and stuff. Same with Pringer Center, they don't want anybody coming in and out of there. So, I know Donnie probably wants out, but not to be mean about it, too bad.
Yeah, I
That's the
mean,
best place for it.
The thing is, the initial employee, when they get here, I mean, as part of their check-in process, they have to get the picture and all that.
Mhm.
And that's really when the card needs to be developed. Now, whenever they get assigned to a particular building, that can come, that can change any point in time. I mean, just because they start out this way doesn't mean next week they're not gonna be doing something different that they need to have access to. So, I mean, you get kind of two different things going on, but, to start out, everybody gets an ID card. I thought that one of the companies, was it DH Pace, that we could use all of our existing cards?
I think all of them.
Okay.
Because they're gonna use the same iCloud.
Well, we didn't ask that question on both of them, and I don't, but I think one of the big deals was the existing cards, we can import it into their database, and so there's really no big change. Obviously, the access will change because we're adding buildings. I mean, Carnegie doesn't have an access control now, but we're gonna have access control from this point forward. So those kinds of things have got to be added to whoever gets in those buildings. So that's, it's a little bit kind of the same thing, only different. We're gonna be able to use what we have, but it's gonna be expanding. But my contention is we still need an overall somebody to run it. I mean, each building can do their thing, sure. And I think more what Scott's saying is that it's more of an emergency. We got to shut this person down, keep them out of the door, get them out the door and be done. But, when somebody comes in, as part of the check-in, they say, okay, this person needs to get into this, and this, and then that's initially a setup by the central control. But that would be the way I would envision it. But, I'm not saying who's going to do it or not do it. I'm just saying
Is that how it's done now? I mean, does Donnie set up where they can access?
yeah,
Yeah.
I mean, different buildings too?
we don't have any different buildings.
So-
See, the only place we have different is the sheriff, and they do their own thing over there, so.
I think right now they set up like times of day, like the time of the day when you can access the building. So like, does yours have 24-hour access, or you only access from
Yeah.
7:30 to 4:30?
And what doors you can get into. I don't know about the Sonatrol. I don't know who sets that up.
Yeah, Donnie basically sets up the annex in the courthouse, exterior doors, the interior doors at the courthouse, and the interior doors, Larry's office are controlled by basically their own management group, because you have to call Sonatrol to say, hey, we want a new employee
Yeah.
coming in, and so Sonatrol basically, or Stanley does it, and that's what you're trying to get away from, so you don't pay that.
So who controls who gets in the collector's office? Sorry, Chris.
Right now, theirs is a fob.
Yeah, Larry.
And they
It's a
control
gene-
it.
It's a generic fob that's assigned.
Yeah,
to the
They
number.
control it.
Via a phone call or an email.
They
If send
control
out-
it.
Yeah, right.
Collector's office controls it.
Yeah.
Larry Vincent controls his office. That's why I envision it now. You got a central one that gives you a card that can get in to whoever lets you in. If it's courthouse, annex, which would be controlled by Dale, I heard you volunteering to do that part. Christie would control that department. Is that a no?
Well,
Preston would control
the-
who has access to her office.
You're right, and to a degree. He makes the call. He doesn't get on the software and goes and flips the widgets in the software that says Dale can get into his office. He makes a call. So there's a little difference in the complexity of the operation. There's nobody that does Sonatrol here. They just make.
I don't even
calls.
care about the operation. If you make a phone call or you press a button, I don't care. I'm saying the person making that decision, if the director of health makes the decision who comes in and out of her building, rather than Donnie going, Donnie, we need to let this person in this building, and
Well, I mean, that's what, it's your guys, that's your decision how you want it to work. I'm just offering.
that's the way I would envision it working. I'm just one though. If you want one overall, I don't know, maybe that would work better. I think it would be more confusion. Chris can decide who comes in and out of his, and, maybe one day I'm fine and he lets me come in and out of his building with my card, and next day I can't. What happened? So,
I think the benefit to having one person is if Chris has one employee change per year, gonna be difficult for him to try to remember how to add that employee and get back into the program. To say he's gonna be able to get this employee for an 8 to 5 job or 24 hours a day, as opposed to having somebody that's familiar with the system, familiar with the software. Chris has to give him the okay to say, yes, we're adding this employee, and I want these particular hours, and so the guy that's familiar with the software then says, yes, you know, and keep a record of it. This is, you know, when they told me, how they told me, and this is who's gonna be using the system, and then they can put that system, or that person in that database, and basically set up that file or that key card up to where now that key card functions 8 to 5 days a week. That's what I'm trying to get away, you know, because if you don't do it that way, you're gonna have multiple people trying to put it in their, and if they forget how to do it, then they're gonna put it in their own way, and then you corrupt the database. If you have one central person inputting the data, which is what kind of Sonatrol does off-site right now to a lot of facilities, they just have a database person, and they control those databases. All they're doing is getting emails or requests saying, hey, you know, this person's coming in, these are the hours I need, and so then you just have a database, person load the data, I guess.
Well, Melissa left, so I say we just put it on her.
Let her know she's so highly thought of.
Sheriff's listening, we put it on him. Sorry, Greg, I throw that in there.
No, I mean, that is the big problem, is who's gonna get, I mean, the deal is it's a security function, so I've never quite understood the security here, who runs it or not, I don't know. But, it's, I've only been in one other place that had it, and that was the hospital, and I can't even remember how that turned out. I mean, it was quite the deal, but you had 1,300, 1,400 people, that it was pretty big. But it's, the deal is, the more turnover you have, the more time it takes, because you're dealing with people all the time. It's different if nobody ever left, you just set them up and live happily ever after, but if you got a lot of turnover, then you gotta get them in and out, you get replacements, and it's a lot of time. Anything administrative is, like anything else, and just the more turnover, the more time it takes.
Well, if y'all are saying it's easier having one central person doing it, I'm fine with it too. I thought each.
Well, I think Donnie knows how to do it. Donnie's done it, so I don't know what Donnie's plans of retirement are, but I guess if Chris would hire somebody new, he could email over instructions, say, okay, so-and-so was coming over.
Well, I don't see what the difference would be doing this versus what he's already doing. I really don't. I
Yeah.
mean, it's essentially the same product.
Yeah.
I mean, you get the badge, you get the picture, he puts them together, prints them off. He's got the devices to do it already, and I think they said they would work right. I mean, what we already have.
Yeah.
So, I mean, I don't know, but that's me volunteering him, and that's not my position to do that, but it seems like it's very similar to what he's already doing, so. And he is, I think, my understanding, the security of the courthouse anyway, so. And they're monitoring, they monitor the video cameras for all the buildings and stuff like that, so.
I think it's a small detail. I mean, who we're gonna put in charge of it and assigned to do it, so I just think we award the contract and if Donnie has problems or whatever, we'll figure that out, so.
And my 2 cents worth on the recommendation would be what's the all systems?
Yeah.
Because they do a lot of business here. You're right, and they're Columbia. I think the other ones they're very close on what they offer, but the fact that they have, people here seem to be relying on them as well. I mean, that's a good recommendation that you've got both the schools and the city has them too, right?
Correct.
So.
Okay.
So we gotta decide on the buildings, or we decide to go ahead and do all of them that we had bid?
I would do all of them, because I don't think we're gonna be out of the
So we're
Carnegie
okay with all
building.
systems? And then, Chris, what you're, Sam and I said all
Yeah,
all
so
buildings?
Health, Carnegie, the courthouse, Annex, ESB, Pringer. Yeah, I said we do all those.
Mhm.
Okay.
I mean, especially Pringer.
What else, maintenance contract then, we're at that, whether we do
Are
a
you wanting
service
to do
agreement?
the hourly rate? Because like I said, their maintenance contract is very customizable, so it's not anything that would require a separate conversation, I guess.
I'm for not doing a maintenance contract and just doing an hourly rate.
Yeah, and we'll just see what the cost, if it ends up being
And like I said,
really,
this company
really.
I did talk with, we can do it a year and then
Yeah.
jump on when there's
Okay,
nothing.
that's
stopping
what I was
us
gonna say, I
from
thought
doing
you mentioned that the last time, that if we decide, okay, this isn't working, maybe wasn't the best decision, we tried it, changed our mind.
Yeah, we're
now,
spending
we can move on.
thousands of dollars or something.
Okay,
then we-
what else do you need?
that. That's it.
I need permission to cancel all the contracts with Sonatrol.
Oh, yeah.
Let's wait till we get a contract with All Systems first, I don't think we have that contract
No,
yet.
we don't.
Okay.
Okay, so we can,
So we need to have this system
Award
getting
the-
ready to be put in before we cancel all that, because then Premier won't have anything.
You wanna get the database from Stanley prior to, because once you cancel the contract, then they'll lose the database. You wanna try to get all the database so that the other company can integrate that card information within their own database. So you basically build, the new system, All Systems will then build the database based on your current criteria, cards, so you don't have to replace cards, you don't have to, the employees all have a identification associated with them, so get all that stuff up front.
All Systems knows how that, All Systems knows how that all works, anyway. So they know what to do.
Well, the
That's
problem
easy
is
for you to
you
say.
got-
So they know what to do.
You have
Yeah,
a-
you get part of your
Okay.
database.
So
Okay.
It's
Contract.
part of your database.
Okay.
And Stanley has all the Premier Center, Stanley has Larry Vincent's office and the prosecutor.
So if we award it to All Systems today for all the buildings and no service contract, then you all can proceed and work on getting that information and getting a contract together.
Yes. Is there?
Debbie was raising her hand or getting
I
ready to
did
throw
not, I
something.
have not paid the Sonatrol bill for this quarter, from June to September, and they're 3-quarter contracts. So I need to know if I should pay that, because I was holding off
September.
on it. So I guess I'll pay it till September.
It'll take them.
Yeah, it'll take
Oh,
us.
yeah, I was
Yeah.
gonna say, it'd take a while.
Okay.
I mean, we can start at the first of the year too. if we-
What I would recommend, if All Systems gonna start with the systems that you have in place currently, not the new buildings, because then you can get out of Stanley's contract and it can be done, and then you start building on the locations that don't have the access control currently. You're not gonna be adding any money.
Okay.
You're pretty
So-
smart, Scott. I like you. I like you.
I move we award the access control system to All Systems out of Kansas City, Kansas.
A second.
All in favor?
Aye.
Okay.
So then, who's gonna be working with them? Is that gonna be Donnie? Is that gonna be you? What all were you, are you done with your part now?
I'm done.
Your advisement is complete.
My advisement is complete.
So, that's what I was,
So hire him as a consultant to work with this company.
I think it's a good idea. We
Yeah.
may need to sit down and talk to Donnie and make sure a couple of people over there, I think Hilke's doing the, pictures and badges and stuff now, so he does have other people working with it.
Elbert used to do that, and I think when Jeff moved in, I mean, he kinda took Elbert's spot, so.
Okay, so he does have a couple people working with it. If they have problems, just tell them, let us know. We don't want it to be a pain in their butt, but I kinda see them as the ones that I would want in charge of
Mm-hmm.
security, I guess.
They're very adamant about only wanting this building in the courthouse, so we'll have to discuss that. You
It'll
guys
be
know.
all right.
Yeah.
I'll talk nice to him.
Okay.
We done?
Yep, thank you.
Right.
Scott, thank you.
Say it, Scott.
Am I done?
Okay, let's go.
Okay.
Yeah.
Signing of Fields Mechanical Credit Application.
Okay. Which one did you have there? I'm sorry, the field?
Fields.
Fields.
Mhm.
This one was okay by Jill, and she was okay with the language in it. It was just basically for the maintenance department manager to be able to buy supplies from that company. So, and they wanted a credit app filled out, because that's just how they do business.
I move we sign the credit application with Fields Mechanical.
Second.
All in favor?
Aye.
Aye. Signing of Johnson Supply Credit Application.
And Jill didn't like the wording at the bottom of that credit account. It's something about the litigation could be handled wherever they wanted to. So we're still working on that one to get that language changed, so
Okay.
no action on that one.
No action on that. Signing of JCMG contract for Show Me Healthy Women.
You guys signed the rest of these, I think, a couple couple weeks ago, but this is basically for JCMG to provide those services through Show Me Healthy Women, and then we reimburse them, like the mammograms and things that we can't do at our office. This one just got left off.
Same as what we did before, just
Yeah.
different name.
That was the surgery center, and this is like that ancillary services center. They have to have separate contracts for each of their centers.
All right, I'll make a motion, we sign contract for JCMG, Show Me Healthy Women.
Second.
All in favor?
Aye.
Aye.
Second reading of budget adjustment number 9. Debbie.
Number 9, this is for $16,091.88. This was for the sheriff's department on their salary supplemental grant. So I do need a motion and approval today for that.
I move we sign and approve the budget adjustment number 9.
Second.
All in favor?
Aye. Number 10.
Number 10 is for $17,900, again, the law enforcement fund. It's for the employee payroll deduction, for that gun purchase.
I move we sign, approve and sign budget adjustment number 10.
Second.
That's clerk.
Unfolded, I think it's folded.
Sorry, yeah.
I think you're underneath of there,
Oh.
ahead from you. She's getting kind of tricky. You've been kind of cantankerous lately anyway.
Call the vote.
All in favor?
Aye. Discussion of Family Heritage Life Products.
Okay, well, I don't know, this gentleman's, all I have in there is the card from
I'll
him.
pass that back to
He's wanting
Chris.
to- I guess he's done business with Pettis County, he is from Pettis County. He's an agent, wants to come in here and sell products to
I'll
our
pass that to you.
employees. Basically a payroll deduction or not a payroll deduction, but it's the same products as what we have for the.
I'm gonna say no right now. He's got access to know who all we've got employed. If he wants to contact them individually, he can. We've had people come up here before. If y'all want to discuss it further, you can.
I'm with
I
Jeff,
just-
no.
No,
I'd appreciate him asking, but we'll have everybody in here wanting to.
And he's probably made 4 visits already, so.
yeah, I met
I
him
don't
too,
blame
but
him.
we, you
That's
know,
fine.
it's,
He's a salesman, but
And I told him there was plenty of local agents here in our county. so
yeah.
That would probably be preference, but.
and we'll have every one of them wanting to come up here and make presentations and solicit
Well, you'd almost have to
everybody
let 'em,
too.
too.
So I don't think we'll need to open that door.
Okay. Discussion of website for county discount perks card.
It must be that time of year because I'm getting approached by all different sorts of people and everybody gives me my number, but anyway.
I do. I'll tell them call Debbie or Sam.
Okay, well, this is an outfit out of, well, they're out of a lot of places. Chicago, Scottsdale, New York, Long Island. Anyway, it's a website-based discount. They give you what they call their perks card, and they want to give that to all of our county employees. With that perks card, then they go out within our area and try to get businesses to sign up to be a discount member. Basically, if there's a dentist in town, they'll go out and solicit that dentist, say, if you want to be on my perks card, it's going to cost you $500, and then there's, 500 people at the county who'd be interested in printing out your perks card and getting discounts. So, I mean, yes, discounts are nice, and this is free to us as far as the county goes, and the employees is free, but they're gonna solicit all the businesses within so big of an area to try to get them to buy into this, and it's up to you guys.
Have they done it for anybody else in the area?
No, not yet. Once they get one place, then they'll branch out to the city, they'll branch out to the state, they'll branch out. I mean, and I could have them come do a demo to you guys. in
Can you
here.
email some information for us to look at? Because I don't,
I mean,
I'm
that's all I
kind of
had, was what-
at a loss of what you're talking about. So we send it that to the employees, and employees got to go out and get people to be on our card?
No.
This
They were gonna do it.
No, they're gonna come into Samuel's and say, hey, we're gonna offer discount cards to the county, so you got almost 400 employees, and if you pay us so much, you know, and give them a discount, I would bet.
And I showed
You know, but we're gonna direct these customers to you.
So we would,
It's
what,
kind of like
put a
those
card in
stupid
with-
ads that they stick on some of the
So they'll have a
dining
website, you can
tables.
go out and look up a vendor and see if they're on your perks card, and then if you take your card into that vendor, they'll give you a discount based on the fact that you have the perks card.
As a
And here's the
businessman,
merchant's
I'm,
fees, what they
I
will
don't-
be soliciting
I don't
to
like
the
stuff like
vendors.
that. but-
I mean, I don't care what the fees and stuff are, I'm just saying, what, is this gonna be something that's gonna be a pain in the butt for everybody, or is this something where it's gonna be a benefit for the employees to have and doesn't cost them anything? We put a card in with their next paycheck and they get to go on a website and say, hey, I can go to Sam's and get a reduced price on a tux, or I can go
The way I
to,
understand, we give them all of our employees' email addresses.
No.
And they do the rest.
then no. I don't want.
I don't send out anything, they send it all out, but we have to give them the names in order for them to get it.
I don't wanna
sorted.
give them any list of names and stuff.
And then they give them, in that email, they'll send the link to their website, and then from that website, you can print your card.
I'm gonna be pretty adamant about giving out our employees'
Yeah, I'm a no
email
too, so.
addresses. I would be more willing to give their website out and say if the employee wants to go to their website, they can sign up for it on their own. And they can get information on their own.
I think it's a package deal where they want all of us at once.
Yeah,
So, yeah,
I think that's the
then
second.
I already get enough junk email from,
yeah.
when I sign up
I
for
agree.
one thing.
Yeah, it says on the contract, we would sign the employee membership notification registration, that we would do the emails. So we would give them all the emails and all the
Yeah.
employees.
No,
No, I don't think so.
Because it may even bog down our emails here, we got enough of it. All right.
But you do get down all the way on the bottom of the agenda. You get
His
signed up
last
late.
one, his last one. I think that- Okay.
I think you are next, though.
Okay, we threw that out, so we got assessor to amend the certified values.
That one that probably takes a recent amount
We
of
have a
time.
problem with the AS 400 in the calculations. The residential assessed value is off by $40. What happened was the way the calculation is supposed to be done, when we have multiple cards, it takes the appraised values, and if you have one residential value, it's supposed to add with the other residential value and then calculate what the residential assessed is, which would be the 19%. But what the AS 400 did was it took the one value, calculated the 19%, then it took the other value, calculated the 19%, and then it rounds the tens up. Well, because it did those two functions separate, it caused the difference in price, value. Is that clear as mud?
no.
Okay, on a card, you've got here, I'll use the example. We've got a residential value. This one thing is valued at $4,010.
Mm-hmm.
And then you've got an agricultural value of $900, and then you've got a residential value of $9,650. The way it's supposed to be done is both of the residential values are added together,
Okay,
then you calculate the 19%.
okay,
What happened was, it took the first residential value, calculated the 19%, then it took the second residential value, calculated the 19%. And each one of those is rounded to the nearest tens.
okay,
So by calculating them separate and rounding each one and then adding them together, it caused a difference of $40 in the
Okay.
overall.
So
It
that-
was the a residential assessed value. I think it showed up with a 950 and it should have been a 990.
so it rounds it to the nearest $10.
Yeah, it does that normally, but what it did was, instead of adding both of those residential items together and then calculating it and then rounding, it took one residential value, calculated the assessed at the 19% and rounded, then did the other one and then rounded and that caused.
I mean,
enough of a
that figure
difference.
should be exactly the same. I mean, whether you add something and then take
Well,
19% or you
But you're
keep it
rounding.
same.
Because you did this over here like in parentheses, and then you add this, and then the parentheses, where it should be, you add this in parentheses first, then you multiply it.
It's the old algebraic
So-
equation. You do this function first.
It would have some rounding, but it depends on where that break off is. But I have a hard time believing
How
that.
many
But
did it affect?
$40
It's $40.
overall, which actually using the highest residential tax for Cole County last year, it would have made a difference of $2.25 in value.
it's fine.
Or in taxes. So, that's pretty much it.
Okay. What do we need to do here? Just approve the.
Yeah, just accept that as the amended values.
I move we accept the amended values from the assessor.
Second.
All in favor?
Aye.
Aye.
Thank you, gentlemen.
Thank you, Chris.
The accounts payable again?
I had a little.
Debbie screwed up.
I did. I denied
What?
some things. I denied them, and when I denied them fully. But I was supposed to just deny it back to the previous level. So because I denied it fully, these should have been paid the last one.
Okay.
And so I got the information I needed, except for I'm still waiting for John Riley to approve 3 of them. But
Did you take a look at them? I didn't.
So is it the 3? I got 3 out here.
Yeah, there should be like
For
3
John?
that are from him.
What's coming from Riley?
I can show you.
Trolleys.
No, stop. Okay,
You know, we do need to look at
this one.
one of them lots up there of, when Coursemark came and talked to us about that one
These
lot
two?
for parking.
Oh, yeah,
We need to maybe look at that.
yeah.
I seen them chopping up the other day when it's 100 degrees.
The one from Fisher over here.
Yeah.
Yeah.
I don't think it'd be a bad idea yet considering that yet. If she's willing to sell it to us at a reasonable price and make it into one. Because
Yeah, actually-
Speaking of donuts,
that would.
Riley's buying donuts.
For jurors.
jury.
Yeah, we need to ban donuts in the courthouse.
I agree.
Oh, is that the health kick?
Hey.
It's not a kick, it's a lifestyle.
I know.
We don't need any jurors being overweight and having a heart attack trying to climb the hill. Need to get them on the mile circuit.
I don't
Okay.
disagree. I don't know why we're buying donuts or greasy fried food.
Yeah.
I don't want healthy food either, but if I don't want it, I'll bring my own pizza. Well, you know that's the way it was when you was growing up too. If you didn't want to eat what's at the table, you're gonna go to bed hungry. So, you gonna come to the meeting and eat what we serve, or else you can leave hungry.
I move we approve accounts payable.
Even John's without the information we need.
It's right there.
Fruit and-
Is that is the info you needed then?
What is it?
You said
He's-
you were
he's
still
just-
waiting on stuff from
he's-
John.
Just has to
He
electronically.
he has to approve it.
Gotcha. I'm sorry. Second.
All in favor?
Aye.
Aye.
I thought you meant you.
He's
were
out
waiting
getting
for-
donuts.
See, I think in New York, that soda you've got there would probably be banned, New York City. Because you can't get
I
those
thought they
big
did
gulps.
away with that though.
Did they do
started
away?
it and it never went through, but.
Debbie,
You know
you just
what?
want
You tell 'em
to send
come
me a note or something when you get
Hang
those,
for a
and
day
I'll
and keep
go out
up
there
with
and
steps
approve
with
them.
me.
He buys a
Then
bunch of
they can tell me what
soda,
kind of soda I can drink. Otherwise,
I'll get rid of the soda.
You see his hair.
Who? No, I haven't seen him in it forever.
Do we have anything else to come before the commission?
One format, but it'll change.
Well, so I had a couple things. So I was at an MMRPC meeting the other day, and Natalie Tackett had approached Ed Sigmund about help for some roof repairs at the Historical Society. My first thought is no, but I thought I'd ask you guys.
to try to get other help.
Well,
It's not
they,
from
they
us.
need a new roof, and he had said that maybe the Cole County Commission might help with roof repairs cost for the Historical Society.
Oh, so he was throwing us under the bus.
Kinda,
But we
yeah.
give them
Okay.
$10,000.
I think it's 7, but anyway, so, anyway, I mean, I just, I was
yeah.
gonna tell her no.
don't
No,
think
I know
that's-
they got a lot of help from some of the trade unions when they were doing their courtyard, so, they might, I don't know.
And then I thought Ed had said something about there was some type of funding. You had asked Jeff about tying that break time into the Taos sewer, and he said, I think that there is some funding through
So did he contact
DNR or something.
the mayor? Because
No,
I've
I
sent
don't
him
know. I don't think
Mayor
so.
Fork's information, and that's what I asked him to talk with them. I don't
Okay.
need to be in the middle of it.
Okay.
I
I'll get-
also sent an email or CC Tony on that, so
Okay.
he should have Ed's information if they want to try to get some help with it. I mean, they need to be a little proactive too. So.
Taos or
Taos.
Okay.
But Ed and them are looking for projects, and I thought that one would fit perfect with either infrastructure or economic development, however they want to look at it.
Okay. So
If
I
he
just-
needs information from me, let me know.
I'll send him an email and let him know.
So-
But
And FYI on the neighborhood, the improvement, I can't remember.
Yeah, I
the
do.
name of that road.
Randall Drive.
Randallville. Lots of emails going back and forth, but they're willing to pay the $1,000 for Joy's fee. I'm going to tell them to make the check out to the county because you guys will ultimately sign the contract with Joy.
Okay.
So I'll put that on the next agenda. I just heard that last night.
Good.
And it just for clarification there, so if another group comes forward and wants to do something similar, I mean, is that a route that we can go with them too? Is that, hey, you guys need some skin in the game to get this going? And I mean, in general, I just feel like maybe it's not a legal document that they've signed, but hey, I want to do this and sign my name, and maybe we have to get them to sign it again, but at least they're putting up the front money to do it, because I don't feel like we should have to put up the money and then hope that it happens.
No, I
Yeah,
think
what
that
if they
was a good
change their
idea.
mind?
Well, yeah,
You got $1,000 here, $1,000 there.
I think it's a good idea, and I'd hate to imagine how much time we've already invested in this.
right.
To try to help these people with this project.
Mm-hmm. Yeah, it's really them coming to us saying, we'd like to do this. And so they just need to have some skin in the game, so. Anyway, but,
Yeah, I would say start this.
I mean, it wouldn't be any different than if somebody wanted to pay to have their gravel road paved too, so. I mean, that's fine,
Debbie.
gather all the signatures and.
I'm not paying, what are you doing? I'll live on Gravel.
Now you like the gravel road, don't you?
So. Okay,
All right.
Anything else?
I don't think so.
No.
No, I was gonna ask Chris for his United Way card.
Oh, okay.
All right, motion to adjourn. Or stand in recess until
Recess.
4:30. Sorry.
Second.
All in favor?
Aye. So you need that back already?
If you have it.
Did you have a
How's-
kind of thing?
Do you need to check or?
It depends on how you wanna do it, if you wanna do a check. Excuse me, Kristen.
See,
And,
I said, you have a name for it?
jump on him, 'cause he's the only one.